today was going to be a co-presented between Felicity Bright and Alana McCambridge, but unfortunately Felicity hasn't been able to make it today. One of the things that's really important to bring through with her not being here is this is a really very much the heart of her research program and her work, and it's very, very close to her. So she's really disappointed not to be here today to be part of it. But Alana is fortunately, very well placed to speak to this. And I'm going to do a little of an introduction to Felicity because I'm not quite sure who knows Felicity. I know who many of you do, but I'm not sure if there's anyone who doesn't. Actually, so Felicity is an associate professor. She's based within PCR. She also leads the Doctor of Health Science. And lots and lots and lots and lots of other things. She's an amazing academic. Her background is in speech and language therapy, this area of research about life after stroke is very much a passion of her in her research program. Alana is also situated within PCR and has been working quite closely with Felicity and also has her own the research program she's leading around Pacific people and rehabilitation. So I'm going to leave the introductions there. I'm going to invite Alana up, and thank you, Alana.
Cool. Thank you, Jo. Apologies if you came to hear Felicity, but it's just me today. I know she's a big draw card, but I'll do my best to represent what we've been working on and invite some discussion and feedback on the project. Like Jo said, this is very much a project that is led by Felicity, where she very kindly has collaborated with the rest of us into pulling it together, and it's very much based on her long-time work in this space and her long-time connections and relationships that she has with people in this space as well. Cool. So in terms of a little bit of a background to the project, I'll just go through the title first. So the project is titled Life After Stroke, Identifying Research Priorities to Support People to Live Well After Stroke. And where the idea for this project came from was, like I mentioned, long-term relationships that Felicity has developed across her career, and kind of these recurring themes of people saying that there's not enough support and there's lots of gaps in terms of the after rehab or after the hospital, what's for me next. It also stemmed from this idea that there were pockets of research in this space being done across New Zealand, but they weren't really strategically combining together to have a groundswell and a change in this space. So that is kind of the idea of where the project was born from okay, there's definitely interest in this work, there's a need in this work, there's people in New Zealand that could help with this work, but no one's really coming together to work in this space strategically. So Felicity thought it would be a good idea to apply for the HRC activation grant with myself, Dr. Tracy Murphy, who hails from Ngāpuhi, and she works at Te Whatu Ora. She's a OT. Her role is clinical and academic lead in health gain development, which previously used to be called health equity, but they changed that. She is a DHSC graduate of AUT, and so she has really been leading the Māori stream of work, as well as Professor Julia Slack, who is the head of nursing at the University of Auckland and also has a long-time program of research in stroke care. We also have some advisors on the project, both with lived experience and different perspectives as well, that are working with us to help guide us in what I'll share, we hope will be the end goal of this research, or the start of the next phase. So in terms of the research grant and our goals, it was to build connections, both with people with lived experience of stroke, healthcare professionals, services that provide stroke care, and researchers, to try and finally bring these 4 perspectives together. We wanted to map what's currently happening in this life after stroke space, which I'll define shortly, ultimately leading to health delivery priorities and research priorities that strategically researchers could work on and start filling some of these gaps that we kept hearing about over and over again. So in the literature, there's kind of been this surge of priority setting research. So I'm not sure if anyone works in this priority research setting space, but there's different methods and ways of doing it. Some involve ranking ideas together, some's consensus-based, experts. Across the whole, not many get all 4 of those stakeholders together. So lived experience, clinicians, researchers, and services all contributing to these research priorities. So that was definitely something that we wanted to try and do as we create our own research priorities for New Zealand. Our project involves lots of, I guess, pieces of knowledge that we're then putting all together. So it's a bit of like a puzzle. So we've been doing a review of the life after stroke literature. We've been mapping research priority literature as well that focus on the life after stroke space. We've been talking to Stroke Aotearoa in New Zealand about what their needs are. We've had kōrero with people with lived experience of stroke. We've also been visiting stroke groups to get their perspectives. Been talking with stroke support organisations. We have done some surveys, online surveys, to start gathering some of this data, so both with people with lived experience of stroke as well as with their whānau. And we've done a survey of healthcare professionals that work with someone who has had a stroke or support stroke. All of these activities we like to underpin with, I guess, the values or principles of our research program, being that it's about building relationships, encouraging diverse perspectives, and partnering for the long term. So we've been undertaking this work so far at various stages, which I'm going to basically summarize some of the findings of where we're at the moment. But what do I mean when we say life after stroke? So it's basically anything after the acute management of the stroke event. So it involves both the rehab and the recovery of a stroke, as well as the living well. How do I live my life? And what are the things important to my life? So in terms of living well, what are the meaningful roles that I have in my life? Maybe work, life beyond services, relationships, and how do I participate in my community? However, this is our conceptual understanding of life after stroke. But when you go to the literature, the leading definition is by this author called Alex Pollock, and they define life after stroke as all aspects of general management and rehab, prevention and management of complications arising from stroke, and life after stroke, so a circular definition, which includes return to work, family roles, leisure pursuits, relationships, and quality of life. They say life after stroke has no restrictions relating to time, but it doesn't include assessment, immediate management, pharmacological or surgical interventions, or TIA. So this is the definition in the literature, which I guess guided our thinking around some of the literature review articles that we've been doing. So we thought, okay, if this is the leading definition, then we should screen the literature for priority setting research that fits in with that definition. And so when we did that, we found 9 research activities. So some had multiple publications, but you could tell it was from the same event, maybe the same conference or something. 5 were from the UK, 1 from Ireland, 1 from Sweden, and 2 were international collaborations. So none from New Zealand. When we extracted anything that they listed as a priority for stroke care, there was 287 priorities. 189 of those priorities aligned with some aspect of the POLIC definition, but it was very much weighted towards this management of stroke and rehabilitation. So, what was the optimal dose for this? What was the optimal intervention? What was the right time? And that kind of thing. And the living well part of stroke here in green, it's very much a bit pushed to the side, or not a huge focus of the life after stroke priorities, okay? It was still very much about what can clinicians and services do, and less about what might people and their whānau who have had a stroke do to enjoy their life, kind of thing. And a little tiny bit about prevention on the secondary stroke. So we thought that was interesting and gives us some legway or segue into the literature to maybe write our own definition or help clarify this circular definition of life after stroke. And so besides that priority setting literature review, we've also been trying to understand what's important for life after stroke, as well as unmet needs and gaps in evidence. So we have done another literature review on the life after stroke kind of qualitative studies. So what are people saying is important to their life after stroke from the person who's had a stroke, their whānau, or what have health professionals have said is important for supporting life after stroke. And we've done that for both any literature that was done in New Zealand, as well as any literature that related specifically to Māori. And interestingly, most of the Māori literature actually sits in unpublished theses. So if you met Rhiannon, that was her summer studentship that she worked over this past summer, and we definitely found that there was quite a bit of literature out there about what matters to Māori in terms of living well after a stroke, but it was in master's and PhD theses. So we got that information from the literature. We also, like I said, did some online surveys. We had 25 people complete our stroke survey from a lived experience perspective. 14 whānau or caregivers gave their perspective, and then 60 healthcare professionals as well gave their perspective on what matters, what are the gaps, unmet needs, and what are the research gaps as well. We started to ask people. We started to talk to people in different stroke groups, as well as with the relationships that Felicity has, connecting with individuals and kind of bringing them what we're finding as we're going along this research, with this research, and kind of sense checking, is this what they were meaning? Is this what do you think there's anything missing? So that's kind of where we're at with pulling all of that knowledge and information out and bringing it to light. And what we've tried to do, which is a very kind of new analysis for us, it's preliminary. What we have tried to do is pull that out and see where are where's the agreement across everyone, where's the disagreement or divergence, things that were mentioned by certain groups and things that weren't. So across the surveys, the literature, and talking with people, we've tried to map what were the key themes across what people were saying, using all of that data, I guess, pulled together, and kind of look at that. So some of the themes that came out for people who have had a stroke, so lived experience of stroke, the themes came out were settling into a life that brings joy. And so that was ideas around finding a new version of yourself, as well as emotional and psychological well-being, and having this sense of I can live a life that has joy in it. What the blue boxes mean is that if people with stroke identified it as being important, if whānau identified it as being important, and if the gaps or in current services identified it as being a gap as well. So if we saw that there was concordance across those three things, then we said we were in agreement, and this is going to help us think whether this is a priority for life after stroke. Another theme, having purpose, meaning, and choice. It was, a lot of this data was around independence, but not necessarily physical independence, just having the choice and control over what my life looks like now that I've had a stroke. And we found that, that hadn't been mentioned in any of the whānau data, but it was important to people who have had a stroke, and it did get mentioned in some of the gaps. Another theme, connecting with others. So that was both connecting with my family, as well as connecting to other people who have had a stroke, and connecting to people in my community that didn't necessarily have a stroke. So even at the stroke groups, we kind of got this feedback that, like, just because I've had a stroke doesn't mean I just want to be in a stroke group. Like, I actually have other interests, and I want to connect with other people as well. But I do come back to the stroke group because it's where I feel comfortable and understood. But yeah, there were funny conversations because they're like, I don't really want to be here, but but I see I'm getting some benefit from being here. But another theme, knowing and understanding your stroke. And so people wanted a bit more than the generic information. They wanted to really know what happened to them, and have resources to help them understand it. There was also this idea of the right time and the right form for receiving this information. So when people are in the right space to hear it is the good time to give them that information. So maybe when they were in the hospital and people were talking to them, that wasn't the right time. But now, later on, they're now ready to hear it and to understand. Theme 5 was support for stroke as a lifelong condition. So this was interesting. People didn't necessarily want their stroke to just be viewed as this acute medical condition. They wanted it understood as it's lifelong. I have these impairments and I'm going to live with them forever, kind of thing. The other two themes, being understood and included in society. So there were comments about the invisible impairments, particularly cognitive, communication, continence, fatigue, that weren't always so obvious or cared about by health professionals or others trying to support them. So they wanted, increased understanding to reduce this stigma so they didn't feel so excluded in society. And lastly, this idea of life context that supports people to feel to feel settled, to feel good. And this was about housing, finances, transport, social supports, all the prerequisites to having a good life, okay, that they spoke about as well, which obviously can be disrupted a lot when you've had a stroke and now you have extra transport needs and financial burden and stuff like that. In terms of the literature and the surveys relating to Māori, the 4 themes that came out with this idea of te taha Māori, which is a concept that basically means my Māori side, but it has 4 components to it, so that te reo is important, tikanga is important, wairua is important, and a collective sense of family or whānau is important. So it's kind of like this bigger super concept that has these 4 things in it, and we could definitely see the data mapping to being important. Interestingly, a lot of these things were identified by Māori, but not quite identified by the healthcare professionals in the same way. Tino rangatiratanga was another theme, I guess, about being informed, making choices that drive their own care and life, And also this idea of te waharoa, a space where information is shared in ways that are culturally appropriate. We captured in that theme as well. Supports for Māori, by Māori for Māori, talked about the benefit of having other Māori care for them, iwi-based services, and communities like close to where they live that understood them and understood their Māori side. These support services, they conceptualized as being more wraparound services that included the whānau, and that's why they liked them and it benefited them. And this idea that it didn't break them into their diagnosis, and it reflected te ao Māori and Māori models of health. And so Māori staff were seen as key to helping people feel safe and supported. The last one about whole person care. So this idea of wellness and not focusing on my impairment. You know, I have a holistic, multidimensional well-being. And that in particular includes the whānau as part of my well-being as well. Lastly, what did the literature and the surveys and talking with people who are whānau or a carer of someone with a stroke reveal? We found the data mostly mapped into these 5 themes. So finding a new normal as a whānau, so going through their own process of adjusting their family unit, taking on new roles in the family, managing their own grief and identity loss alongside the person who's had a stroke. And then, lots of people describe the challenges of looking after their own well-being as well as looking after their family member who's had a stroke. Having support, information and capability to care over time was another key thing. There was definitely one of the stroke groups that I visited in Hamilton. You know, they were reflecting on how they were a nurse, so they knew how to care for their family member. But, you know, if they weren't a nurse, oh my gosh, it would have been terrible, you know, that kind of thing. And they don't know how other people who didn't have health backgrounds learned how to be the carer, you know, all of a sudden. So definitely asking for more systems and support around teaching the carers or helping the carers. Whānau well-being, so being seen as a person as well as the carer and not just the carer, so their own well-being, their needs, that they need a social life as well and they need an identity outside of being the carer. And one of the gaps, I guess, was that tamariki, so children also impacted by having someone in the family who's had a stroke, were really acknowledged. So really seeing this whānau well-being as being collective and everyone must be good for the well-being of the whānau. Again, being connected with others, so that might be being connected with other carers, as well as people outside of stroke or health, and this like idea of sharing their knowledge of how to get through the system, and that kind of being really important. So to help them through the difficult times and knowing how to navigate a fragmented system. And lastly, holistic and culturally responsive care that appreciates and includes the whānau and the care as well. So they saw that as being important. So these are our initial findings and what we're doing to try and bring together the different pieces of work that we've been doing. I guess we see it as not running a big survey and that's the be-all and end-all. We really think it's good to find these pockets of information. But what we are finding is that both within the literature and within our own research, there's still perspectives and important voices missing, and they're being, we've been actively trying to have these people and their perspectives included in the research, but it is hard. So in the literature, there is basically nothing about Pacific people in terms of life after stroke. Asian people, people with communication difficulties. There is some definitely around the speech language therapy space, because Felicity's probably done that work herself. But in relation to cognitive difficulties as well, there isn't that much. And older people with stroke is what I mean, kind of the old of stroke. So their perspectives are absent from both the literature and hard to get in for our research. But if you know anyone and you would like to introduce us to people, we're actively trying to bring in these diverse perspectives so that they're not forgotten yet again from the research. What we've also been doing is asking people, so these are, and looking in the literature, and so these are quotes from clinicians when we've asked them what research or what evidence gaps exist and what research do you need to help your service, your clinical practice run better. And so it's been nice reading people's ideas, and absolutely, the clinicians being at the forefront or the face of the interaction with people with stroke. They've got a lot to say and a lot of insight as well. And so, some quotes about emotional and psychological support, whether that's over the phone or internet, resources in terms of that, local support. There were a few mentions of wanting audits or wanting data to try and show people, show policymakers, show people who maybe are in help with funding or something like that. These are the gaps. We need the data. Research for Māori and culturally appropriate services. Guidelines. People wanted guidelines about selection and delivery of assessments and interventions. Again, this absence of understanding the cognitive impacts and what they can do to support. Secondary reduction of stroke, given the GP crisis. So this was acknowledging that the kind of long-term management of someone who's had a stroke, it might be the GP is now the person that they connect with, but if their GP is changing every time and they're not having that family GP care, then what does that mean for their long-term management or long-term support rather? Meaningful outcomes, cost efficiency data. So again, wanting data so they can make cases about their service and what they might need, and co-designing services. So not just discrete interventions, but implementing approaches that better attend to living well. And they wanted the health and rehabilitation system to learn as well as part of the research. So some pretty cool ideas coming through. And so in August, we'll be holding our priority setting hui, and we want to bring together people with stroke for their lived experience of stroke, clinicians, researchers, so us and other researchers, whānau and carers, and people who work in stroke support services like Stroke Aotearoa. We're going to hold this hui and ultimately, hopefully, come up with our New Zealand priorities for life after stroke, so that we can work on establishing the relationships of who works in these spaces and who can collaborate and support strategically to drive some of this research that's needed to come together. So we're not, again, doing little pockets here and there, but a bit more strategic thinking of having a groundswell of research to shift things together. And we're still in talks with Tracy and our other Māori advisors about how would we do priority setting where it's for Māori by Māori kind of thing. So that would also sit along either this hui combined or a separate one as well. But yeah, that is to happen in August. Our other next steps, We're doing further searching of the literature about and synthesizing it about what's important for Māori in terms of the life after stroke space. We've got 2 online webinars booked for those who have said they're interested in keeping in contact about the research. One is to be held tomorrow, and then another one in July. We're actively seeking opportunities for the missed perspectives that we really, really want to include in this research. We have some advisory group meetings set up. And then, yeah, like I mentioned, our priority setting hui in August. So if you're interested in hearing about the seminars and the hui and anything else, you can scan that QR code, or you can ask to be added to our mailing list where we keep everyone that's previously said they're interested in the work up to date with what we're doing. Yeah, but again, I just want to acknowledge that this is very much led by Felicity, and that, yeah, I'm happy to speak to it today, but yeah, it's really based off her long-term career of work in this space and the awesome stuff that she's already done. So yeah, that's it for today. I'm open to any questions.